Karmanos Cancer Institute is known for providing better treatments to its patients, which ultimately leads to better outcomes. Currently, proton therapy is not available to our patients or in Michigan, but it is coming soon. So Dr. Bepler, could you tell us what proton therapy is and how that differs from radiation?
Proton radiation is really a high energy particle beam radiation. So if you think of the standard radiation that we're giving are photons, and protons have much more mass than photons and much more energy. So when you actually give proton therapy, you really deliver the energy that you need to deliver in order to destroy cancer right at the cancer site.
Does proton therapy treat all types of cancer?
Well, principally speaking, yes, it does treat all kinds of cancer, but you want to really take advantage, maximum advantage of the abilities of proton therapy. So if you think about that, it would be either tumors where you require a very high dose of radiation, like for example, melanomas or sarcomas, which do not respond very well to standard photon radiation. So that would be an example. Or alternatively, it would be cancers where with standard photon radiation, you deliver too much radiation to the surrounding normal tissue, and so even so you kill the cancer, but you also destroy a lot of surrounding normal tissue. So the advantage of proton therapy there would be that the so-called scatter radiation that goes to the surrounding tissue is much less. And then you can really deliver the energy to destroy the tumor directly to the tumor and much less to surrounding tissue. What most treatment centers have been doing is focusing, for example, on prostate cancer, because there is a lot of surrounding tissue that tends to get radiated by standard photon radiation. So for example, bladder and rectum and surrounding tissue, while you really want to deliver the maximum dose to the prostate only. And that's one of the tissues that you could target with proton therapy.
Where is the Proton Therapy Center?
The Proton Therapy Center is in Flint, Michigan. So it took multiple years to actually build this proton center. And at the present time, there are probably about 10 to 15 proton centers in the United States, but there is none in Michigan. And also there is not a proton center that is as advanced as this new proton center in Flint, Michigan. We call this a second generation proton facility, and the reason why is because there's two reasons really for this. One is the protons that are being generated are generated to the level of energy that is required for therapy. And second, the proton beam that is being generated can be targeted better to the tissue than before. Now with this new facility, the protons get generated to the level of energy that's required for the treatment. So if you want to have deeper tissue penetration, you need more energy for the protons. If you want to do tumors that are closer to the surface, you need to generate protons that have less energy. And so it's a more efficient way to produce the protons. So with this new facility, we can now target the proton beam with the same sophisticated methods that have been used to target tumors with standard photon therapy. So we can use CT guidance, and we can very specifically contour the proton beam to the tumor. It's probably pretty fair to say that it is the most advanced proton therapy center in the world. What we have to do, and we are in the process of doing this, is to develop protocols, because you have to think of this as every patient that gets enrolled in proton therapy center, we have to learn from the treatment, and we have to see how effective the treatment is, because it is a new device in essence that is being used for therapy. So every patient will participate in a clinical trial, and we will target specific types of tumors. Of course, One of the tumors we will be targeting is prostate cancer, simply because there's already a lot of existing data on it, but we will also focus on other tumors like head and neck cancers, for example.
Dr. Bepler, you have dedicated your entire career to treating cancer and to researching it in the lab. What is it about proton therapy coming to Karmanos that is so important to you?
Well, it is very important simply because we have to make further progress in treating patients with cancer. We have made a lot of progress, particularly in the last 20, 25 years in treating patients with cancer, but we still are far away from being able to really cure everybody that is diagnosed with cancer, and that is what our ultimate goal is.
Dr. Bepler, thank you so much for taking your time today to talk to us about proton therapy. Obviously, it's going to be yet another treatment for Karmanos patients, and we're all excited for the opening of the new center.
Thank you so much.